Everybody, welcome to episode 2.
Hi, I'm Debbie Levy.
Hi, I'm Ronnie Johnson.
Hi, I'm Stephanie Marquardt.
And I'm Lisa McIntyre. Welcome to Working Wonders, where 4 balloon professionals from different walks of life share their thoughts and experiences on the topic of the week. In tonight's episode, we'll be discussing the coronavirus with an amazing balloon artist, talented performer, and medical doctor, Andrea Noel.
Hey everyone, thank you all for having me on the show.
Our pleasure.
Welcome, Andrea. For those of you who are new to the Float family, Andrea, would you mind telling us a little bit about yourself?
Sure. So as Lisa said, my name is Andrea Noel. I've been a balloon artist for 25 years now, and a medical doctor for a little less than that. I came to balloons as a surprise gift for my 14th birthday, which was a book from my mother on how to twist balloon animals. And that's just blossomed into something that I say is pretty much the best part about my life. And completed medical school in 2012, I think. Gosh, you think I'd know that right off the top of my head, but it's been a long 8 years. So, and I was previously internal medicine and pediatrics, and I have recently taken a position in medical informatics, which is the IT side of medicine. And I'm currently doing research on one of the largest COVID databases in the world.
Wow.
Very cool.
We've got a couple questions for you, but first I want to remind everybody that we like to interact with the audience here. So if you've got a question for Andrea, please feel free to put it in the doobly-doo and we'll try and catch some of those throughout the episode. Debbie, you want to go ahead and get started?
Sure. I had a question, actually. Well, that sounds so silly. Of course I have a question. We talk a lot about antibodies and whether you have them or whether you don't. And even some people who thought they had the virus have antibodies, and a lot of people who don't remember having it do have antibodies. But lately I've been hearing that people who had the virus for sure had antibodies and now no longer do. So what's the scoop with that? Like, once you've had it, can you count on not having it again? Or do you have to have your antibodies checked every 6 months, or will they re-emerge if you get it exposed again? Just lots and lots of questions, but I'll make it that one.
All right, that was a fair amount of questions all at once. And so I'll start picking through that, and if I miss something, feel free to clue me in. Let's just start with what is an antibody. So a lot of folks out there may not know what an antibody is. So an antigen is something that your body recognizes as foreign. That could be a virus like coronavirus. It could be pollen from the neighbor's tree next door or farm down the road. It could be any number of things, including occasionally your own tissue, if in the case of an autoimmune disease. And an antibody is a protein that your body makes to tag things that are foreign for destruction. So antibodies against coronavirus will stick to the coronavirus and let your body know this is not a great thing. We need to take this down. So with that background, let's dig in a little bit more. So there's multiple types of antibodies that you produce. And some of them are produced early on when your body first sees a foreign invader, and others take a little bit more time for your body to ramp up manufacturing for. So when we say that antibodies are disappearing, sometimes that might be in reference to that first wave of antibodies that comes in during the fairly early in the infection process for coronavirus. And we would expect those to drop off because that's the natural way, that's the natural course of things, how your body defends against viruses. Now, the next wave, you're going to have a spike as your body ramps up production of that, and it's also going to taper off, and this is normal. Now, if your antibody production went to zero or you had zero antibodies left, that wouldn't really be normal after being exposed to something like a bacteria or virus or something like that. However, we also have to question the test. So there is a fair amount of variability in antibody tests currently, and I know that this was hot news a few months ago, but that sensitivity and specificity of those tests, depending on which test it is, you may think that you have less going around than you might actually have. Now, it also, another thing to think about is how much antibody is the right amount of antibody. And we don't know, actually, what the right amount of antibody is. One antibody might be a better fit, and so you may not need as much of it. It just kind of depends person to person. Now, for other things that potentially you've been vaccinated against in the past, or you've had infections in the past. So a lot of us were exposed to chickenpox when we were kids, right? The chickenpox vaccine was not around when I was a child. I absolutely had the chickenpox and I made antibodies to it. If you were to test me for those antibodies now, I probably don't have as many circulating as I did really close to that infection. But if I was re-exposed to chickenpox, your body will recognize it, even with a little bit of antibody left, and you'll ramp your production back up so that you will generate more antibodies against the chickenpox virus if you were to come in contact with it again.
In other words, it sort of knows what to do because it's already been exposed to that.
Yeah.
Okay.
Now, I think another part of that question was, if I've had it once, am I protected? Did I remember hearing that? Maybe yeah.
In other words, do those antibodies, my grandson supposedly had it twice. He had 3 positive tests, and then 2-3 months later, he got asymptomatic, and then 2-3 months later, he got sick with it.
Well, that's interesting. That's not really that common, but that's not also unheard of. So you potentially could get one strain of the coronavirus and then later get a different strain. And I don't know if we've had quite enough genetic mutation yet in the virus to call things specific strains of the virus, but you may have one that from earlier in the pandemic, and now it's been around the country a couple of times, maybe changed a little bit. And so you didn't have enough antibodies to what you saw again later, and he might have gotten it a second time. It's not common so far, but we have seen it.
Okay.
Let's see, I was reading a study recently about 30,000 patients out of New York, and they were looking at antibody levels for those patients after they had convalesced from the virus, which means they've recovered from the virus. And they did see antibody persistence out at the 5-month mark in a good portion of patients. So that is pretty promising, because initially we were worried that maybe there would be no antibody persistence and we would all just need to really shelter in place. But the evidence is suggesting that we do actually have some antibody persistence, which may lead to some prolonged immunity. But exactly how long, we don't know yet. We're still in the first wave, really, of coronavirus. It's the first year we've had it. We don't know if it's going to be cyclical like the flu or the common cold. We don't know if you get it this year, if the virus that comes through next year will be different, or whether you'd still be immune to that. So there's still a lot of unknowns. I would not tell somebody that had coronavirus that they're off the hook now, so to speak.
Thank you.
I have a question that's come from Sherry Richards in the audience. She wants to know, how will those who have been positive react to the vaccine?
How will those who have previously tested positive for coronavirus react to the vaccine?
That's how I understood it.
Well, I would still recommend, if you've had coronavirus, that you consider getting the vaccine. I don't see that there would be any contraindication to doing that. It could only, in my mind, augment the natural immunity that you've probably already have. And knowing that we do see a handful of folks who have been reinfected already, and we don't know what's coming next year, I think it would still be wise to consider getting the vaccine. Also, the vaccine may help you make a different batch of antibodies than you've already made. And so then it's basically like you've got twice the amount of antibodies. And so potentially you would be even better protected if you were to face that virus again. And we know you probably will face that virus again due to the current prevalence around the country.
So I have a question about, it's a kind of a two-part question. So the CDC changed their recommendation for quarantining, and they went from 14 days to 10 days. But my understanding is 10 days if you test negative within that time. And then the second part of the question is there a test that's more accurate? When I got tested for it maybe 3 months ago, we went and got the ones where they swab up the nose. And my best friend just went and got tested, and she did the one where they actually swab the back of the throat, and she said they're trying to get tissue. So is there one test that's more accurate than the other test?
I don't necessarily know if the test that your friend had would be more or less accurate than the one that goes up the nose. The most accurate test is PCR, and that's a type of test that matches the genetics of the virus, so to speak. And it's very difficult to get a false positive with PCR, and it can happen, but it's not very likely. And
What does
I don't
PCR
know-
stand for? Sorry.
A polymerized chain reaction. And it's I could
And
go
is that
into
also
it
up
more,
the
but
nose? Is that also
Uh,
up your nose?
potentially you could run PCR is how the test is done when it gets to the lab. The going up the nose is how a sample is collected. So
Okay.
you potentially could run PCR off a sample collected in any way. It's just potentially going to the back of the nose is just a place where you're most likely to catch the virus as it's replicating there in your nasal tissues and your respiratory epithelial cells.
So Andrea, going back to the vaccine, what is your advice for people who are non-vaxxers that rely on herd immunity instead of getting their own vaccines? What do you think about that in terms of the vaccine for the coronavirus?
Got it. That's a very potentially inflammatory question, knowing the environment right now. And also, I don't think I finished answering Ronnie's question, which was what was my opinion on the 10 versus 14 days. So, Stephanie, do you mind if I backtrack and finish
No,
Ronnie's
absolutely.
question, and then we'll come forward to my thoughts on anti-vaxxing? So Ronnie, the CDC, you're right, did recently change their recommendations. So previously recommending people would quarantine for 14 days, now down to 10. I wanted to clarify for the audience the difference between quarantine and isolation. So oftentimes we kind of think of those interchangeably, but they're not really. Quarantine is for someone who's been exposed or might have been exposed to COVID. And isolation is for someone that has a known coronavirus infection. And the point of quarantine is to try to prevent the spread of the disease, especially since you could be positive before you know you are. And isolation is meant to protect against the spread of known disease, of course. So the 10-day recommendation is sufficient. Now we say if you have no symptoms of COVID during that time. If, however, you have access to go and get a test, and you could potentially end your quarantine after 7 days if you've been tested negative for coronavirus and you don't have symptoms. Now, if you want to come off isolation, you've had the virus, it needs to be at least 10 days since your symptoms first appeared. You have to be fever-free for at least 24 hours without the use of any medications that reduce fever like Tylenol or ibuprofen. And you have to have your symptoms have to be improving. So you can't still be feeling terrible or getting worse. You have to be feeling better. So I hope that helps clarify that a little bit. And the why go down to 10 days? Well, we've seen so far with when most people become symptomatic and when people are shedding the virus, that if you've been asymptomatic for 10 days after an exposure, the likelihood that you are going to be positive in the next 4 days has gone down significantly. So you're somewhere in a, depending on your situation, your medical situation, how your immune system functions, somewhere between like 1, maybe up to 10% risk. At that point, we think it's more on the low side. And so being is that we feel like you're probably a low risk, low enough at 10 days, that continuing to quarantine at that point might cause undue social and financial burden on people for that low risk of transmission. So that's why we went from 14 to 10.
And also probably less likelihood that somebody will be compliant. In other words, to tell somebody you have to stay home for 10 days, it's not like telling them they have to stay home for 14 days.
Yep.
If they're not feeling any symptoms and they feel well.
Yeah, it definitely increases compliance as well.
If I could interject before Stephanie's question, we have another question from the audience. Christy Carpenter Farrell has asked, she says that she would like to know how long one has to be exposed to the virus in order to be at risk of catching it.
I think that if I remember right, and I haven't looked at this in a couple of weeks, but I thought it was like 15 minutes in close contact, like closer than 6 feet of someone with known coronavirus or coronavirus-like symptoms with suspected infection. I think that's what I remember.
Does that mean that like you could give somebody a hug and then run away and you'd probably be okay?
Probably. I mean, if you're gonna
6 feet, Lisa, 6
without a
feet.
mask and you're not in a quarantine pod together, I'd probably do the look to the side. Don't hug like face to face.
We've been doing the elbow bump instead
Right.
of hugs.
Yeah, the elbow, the elbow tap.
I miss real hugs.
Yeah.
I also miss real hugs, and my kids are probably really sick of me because I'm taking it out on them. I'm like, I need human interaction. Stephanie, what was your question again?
In regards to getting the for non-vaxxers, because I've heard a lot of speculation where people who don't, let's just say, vaccinate their children for anything. They've never had a chickenpox vaccine, measles vaccine, polio, anything. Those people rely on herd immunity. So, 90% or greater of their surrounding communities are vaccinated. So I was asking Andrea what her opinion was in regards to that for the coronavirus vaccine. Can they rely on herd immunity is ultimately what my question is.
Well, there's a couple layers to that. And one, I think there's a difference right now between people who have what we call vaccine hesitancy, where they're a little worried to get the vaccine right away, versus people who are anti-vaxxers who don't believe in vaccination, period.
Right.
I think that the feeling of vaccine hesitancy is something that we're seeing experienced by people around the world. That's not just unique to the US. And the feeling about the vaccine has a lot of variability country to country around the world. So I don't think that's a unique phenomena. And I think the follow-up question to that is, why are some people feeling hesitant? And so we can come back to that. The anti-vax community, as a physician, I am pro-vaccine, so I'll lead off with that.
Absolutely.
I'm not in the anti-vax camp. So if you're a listener and you are in the anti-vax camp, I apologize if my pro-vaccine stance you find offensive. So anti-vaxxers relying on herd immunity, it really would depend on the country achieving herd immunity.
Right.
And what we feel right now with the infectivity of the virus and how prevalent we think it's going to be, it still would probably be a while if we all were to catch it to get herd immunity. And because there's a risk to actually catching the virus, anywhere from you know, I don't know what the latest stats are. I haven't checked in on that in the last couple of days, but you know, if we said even a 1% chance that if you become positive for coronavirus, that you would experience mortality or have some other serious long-term health thing that would happen to you, you really kind of want to avoid getting coronavirus then.
Right, absolutely.
Not just for yourself, for your family and your community. And so widespread vaccination with an effective vaccine is a way that we can achieve herd immunity without everyone getting coronavirus. And because there's a risk of long-term consequences for getting coronavirus or death, I would take the vaccine over those risks, even if it wasn't just for me, if it's for my family members and my community. I feel like it's the right thing to do. And I know that there's people who disagree with that.
We've got another question, well, a comment and a question from Tabitha Miller. She says that she's offering twisting because she will stand way, with 3 W's, behind a table and pass the balloon to the kiddo. A lot of people are asking for face painting. Is there any safe way to offer face painting again?
I don't know.
I know that there's a lot of face painters that talk about actually cleaning their brushes in between, which they didn't do before, but it still kind of makes me nervous.
If you're
One, if
wearing
you're a face
gloves,
painter and you didn't clean your brushes before, I'm not.
Yeah, they would like, you know, take like the same brush, you know, use it on a kid, clean it off in the water, and then use the same brush
Yeah,
on the
that's
next
not
kid. Now they're
cleaning.
actually like cleaning solution on. Like, it makes me nervous.
I always have said, even prior to Corona, when my kids, Lucas, when he was little, used to love to get his face painted. And I would always say, no eyes and no lips. No eyes, no lips. Like,
I got to do one face painting gig and it was only cheeks and hands.
Yeah.
I don't know when we can probably safely say we'll offer face painting again. Face painting seems significantly riskier to me than balloon art if you're not mouth inflating.
if you're wearing gloves, though,
out.
if you're wearing gloves when you're face painting, wouldn't it be like any
well, you're physically like this
because you're so
close
close.
to the person,
Right.
yeah, when you're
obviously
putting
not
the
a face
details. Yeah, and that was what I just acquired my first face painting kit in November, and I was very excited to do face painting this year. And then Corona started. I was like, well, I have a fun face painting kit for myself, because it's just the idea of being that physically close, you know, like there's, even if I'm doing it on somebody's hand, it's like you have the child's hand here and their face is right here. Like there's no getting around somebody being that physically close to you.
I was thinking more of
Let's
the
step
touching
back for
part of
one
it.
sec.
If I could real quick, I do want to clarify to the audience. A lot of people are bringing up how there's antibacterial properties to professional face paint and the 4-cup system and that sort of thing, that Andrea actually has gone to face painting conventions and she is familiar with the safety and health practices of professional face painters.
Yeah,
We are all sure follow those guidelines.
Right. I just think it's a huge liability.
One of the things I want to throw out there is antibacterial properties in face paints do nothing for viruses. Viruses and bacteria are not the same thing.
That's right.
2, I want to come back to something that Ronnie said, and that is painting on hands. So potentially that might be something that we would consider instead of face painting. Because with face painting, you know, a kid really probably is going to need to take off the mask if they're going to have their face painted, if you're not doing just forehead painting, which you could do. But, I would say that if you're a painter and you really want to get back into it, that hands could be the way forward. You wear a mask. The kid needs to wear a mask, and you need to do quick designs so you get them in and out of your chair. You need to use stringent cleaning practices on your brushes, never double dipping in your paint, because I have no idea. Nobody has studied coronavirus stability in
Right.
paint. So I have no way to recommend a safe amount of time or a safe amount of whatever on your brush, but I'd say it's a risk. And then make sure that kids clean their hands, clean their arms wherever you're painting. Probably the forearm is going to be cleaner than hands.
Yeah.
I guess you'd need to judge your own feeling of safety to yourself and your family members, and the feelings of the client, and how well you think you're going to be able to adhere to the safety protocols.
Somebody's brought up about gloves, and I know that Debbie had a question about gloves, so it's a pretty good lead in. Debbie?
I think it was Ronnie who actually had a question about
I had the
Sorry.
question
when we were
about gloves.
talking. But the question is, in
Sorry.
the beginning, I can ask a question about gloves too. In the beginning, I remember I felt like I was some sort of burglar, because people wanted a lot of the yard decor done like really early in the morning, and I'd have a mask on my face and on my hand. I thought if anybody looks out, I would look like I'm about to burgle, because I don't want to leave fingerprints. And then I realized I have these balloons like that I'm attaching to the railing. They'll probably get the idea that I'm there for another purpose. But as this sort of I made you laugh. As this went on, I wash my hands and I use hand sanitizer all the time, but I'm not as particular about wearing gloves. And should I be?
No.
Okay.
Uh,
Good. Yay.
Thank you.
Yeah.
Yeah.
Washing your hands is the way forward. So good soap, warm water, lather, sing yourself happy birthday while you're washing your hands. Make sure that you're not just washing here. You want to wash and make sure you get every surface of your fingers, front and back of your hand, front of your hand, in all the creases. That's the
I always tell my little girl to scratch her hand. I'm like,
yeah, sure.
get
the
under
soap
your nails, scratch.
fingernails.
Yeah.
Mhm. Yeah, and so another thing to call out is gloves are PPE, which is personal protective equipment. They're not in quite a short supply now as they were back in March, but they're really not necessary. And you take those gloves away from potentially other people who may need them for other
From
situations.
people who need them.
Yep. Second, it's expensive. Glove prices have like gone up by 10 times over the course of the pandemic versus what they were last year. Next, it's wasteful to the environment. You don't need these gloves, and every time you unglove, those are going to a landfill somewhere where they're going to take a while to degrade. So the things that you want to do are practice your social distancing, wearing your facial coverings. Don't reach up and adjust your mask every 2 seconds. Make sure wash your hands frequently. If you can't wash your hands with soap and water, use an alcohol-based hand sanitizer. At least 60-70%. Oh, my light just went on. Turn back the light. Okay. Sorry, on a timer. And then once you apply that hand sanitizer, rub your hands, get it under your fingernails, like Stephanie had just mentioned with hand washing, and rub it until it's dry. For surfaces, you can clean with a third of a cup bleach to a gallon of water, or 70% alcohol solutions. If you're using anything stronger than that, you could consider wearing gloves then just for handling the cleaning chemicals. Yeah.
And people seem to realize, like with the gloves, I know when we were talking about it, I was saying, I was laughing at people in the grocery store that were walking around touching things with these gloves on, and then going into their purse and getting their phone out. And it's like, do you realize that you were just touching all of those things with those gloves, and now that's on that surface? And like, even when you're wearing gloves, after you take them off, you still are supposed to wash your hands, even after you use the gloves.
Yeah. And I think one other thing to call out is that a lot of people don't really know how coronavirus is transmitted. It is not transmitted through the skin. It has to go through your mucous membranes, or through the tissue that separates you from the outside world, inside your nose, inside your lungs, inside your mouth, inside your stomach, your gut. Like, these are the places where coronaviruses enter your body. it does not enter, as far as we know, through the
For
skin.
the
So
skin.
gloves are doing nothing for you.
It's like
Except for
having a
possibly-
security gate.
Yeah, it's a bit of
contributing to the
security theater, I
spread.
think, too.
Yeah.
The businesses that are requiring their employees to wear them, just to kind of make people feel comfortable. But then again, it's kind of reinforcing that false information.
The only reason you need gloves is if you're a healthcare provider. That's my 2 cents.
Thank
on
you.
So Gary Ledbetter is watching, and I'm pretty much not going to tell you anything he's saying because he's being Gary. So, but he is learning how to wash his hands, so that's a good thing. Who's next?
I actually have another question. I'm full of questions. In the very beginning, they were telling you, like, when you bring groceries into the house, you should, wipe down the outside of the boxes. I'm not talking about fruit and vegetables. I'm talking about packages of stuff. And they were telling you,
Yes.
wipe the outside. And I will admit that I've kind of stopped that because it seems
I have
not eating
too.
the box. And especially now that you said you need to go through mucous membranes. I kind of stopped that. Is that a bad procedure not to do that? Or
I still do it because people are gross. we get the Walmart, where they load it into the back of the trunk,
oh,
and like, because we went into a Smith's and I'm just watching these people walk around, and we bring the groceries in and we spray them down with the sanitizer, and then we put everything away. We still do it.
I was
It was-
quarantining mine. Like if it was anything on a cardboard box,
yeah.
if we didn't need it right away, I would come down here, I would stick it in my office. No one was allowed to touch it. I left it there for the 3 to 4 days.
Right.
But then there was so much conflicting information about how long it lives on cardboard and how long, and I just was like,
I used to leave the
I
plastic
just can't
shopping
keep up
bag
anymore.
in the.
I would, wash our bananas under scalding hot water, just let the water run. And I was rinsing all the fruits and vegetables that the kids were eating. And,
So yeah, all of that was just
Yeah,
too much
so
work for
yeah.
me. I never disinfected anything. I just
Yeah.
stopped picking my nose with the cornflakes box when I got home, and it's totally the lazy
But
way
how
to
do you
have
how
that.
do you pick your nose now? Wait, what do you, no, just kidding.
right.
with a hand with a glove in it.
Gloved hand
and-
sanitizer.
But for me, it became that not even necessarily having anything to do with Corona, just like going into grocery stores and looking up and seeing like the collective dust on the top of a shelf, or like things like that, where I'm just like, oh, that's always been there, but I never noticed
Yeah.
it. And like same thing, like I do, it became a big thing on TikTok where people were taking their heads of lettuce and they were soaking them in water with salt, and then they were showing the stuff that was coming, like the layer of
coming
dirt
off.
and like little tiny bugs. And I was like, oh, that's gross. I'm gonna start soaking my vegetables and my lettuce. And so I've started doing that.
Well,
We've
And
been
not,
doing it for
like,
years.
there's two ways
I
that you can
never
look at
even
it.
thought about it.
There's two ways that you can look at that. Well, at least I do. So if there's bugs in your fruit, then you know that there's not pesticides on them. So bugs aren't going to hurt you. Wash them off, and then you can eat them.
Yeah, it's nice when I do it and I'm like, oh, that's just that layer of like it's cleaner
Like
lettuce.
yuck, right?
Yeah, but and I'm like, how come I never noticed this before? Like, what's been living in my fridge?
So I've been doing that for years. I wash off lettuce and cabbage, strawberries. Strawberries have a lot of bugs.
I think
Yeah.
it's not,
But I do it with soapy
it's not a
water.
bad idea to rinse your fruits and vegetables just because you don't know if they've had pesticides on them, potentially even if they're marked organic. But I
Right.
wouldn't totally freak out about some dirt on your lettuce either. Humans have been eating dirt for 10,000.
Yeah, the dirt doesn't bother me.
You'll
The
be
bugs.
I've been eating it for 36 years now.
You'll be fine. I guess the question came down to, is it silly to decontaminate your groceries?
Right.
If that makes you feel safer, by all means, keep doing it.
No, it just makes me feel annoyed. Like it's one more thing I have to do. Like,
yes.
I don't know right now exactly. So I think the question comes back to how long does the virus persist on surfaces? That seems
Right.
like the root of the question. And there's a lot of variability to how long a virus is going to last on a surface. So naturally, no matter what, the virus is going to decay with time. So time is your best friend in terms of, Stephanie's approach to putting groceries in quarantine. If you quarantine them long enough, there's definitely not going to be coronavirus on them if no one's touching them. But really, it also comes down to the environment and the viral load and how well that virus is able to stick to a surface. So when I talk about environment, I think about things like the humidity. Drier surfaces mean that the virus isn't going to last as long. Hot, so a temperature 30 to 40 degrees Celsius is going to pretty much cut down your virus, and that's because the viral proteins will denature at those warmer temperatures. And then UV light also accelerates the breakdown of the virus.
Oh, I did hear
if you
this.
eat your groceries in the back of a hot car in the sun for a while, you're probably not going to have any coronavirus on that.
What
Now,
about
what about those like UV light wands that people were buying? They have like wands that it's a UV light, and they were like running the light over things.
I would
Like
say
it's almost like a tanning bed light.
Yeah, so UV is going to kill. It's dependent on a couple of factors. It's dependent on the strength of the UV and the UV wave and the time of exposure. So if we think about something that's sitting out in the sun, you're getting pretty much maximum UV waves hitting that thing versus what is this like little pen light UV whatever? How much
Right.
power does this really have, especially if you're a foot away from the surface versus 1 inch from the surface? Like, I don't put any stock in the UV wands. I think those are probably nonsense. And especially with the speed that they were manufactured, who knows what quality controls went into that in the first place. That having been said, hospitals use UV light to sanitize surfaces. So you wouldn't be surprised if you saw giant UV robots going around hospitals to decontaminate rooms even before COVID. So it's not all bunk, but I think that
What we can get our hands on
UV
probably
wands
isn't.
probably is the
Yeah.
only thing it's helping is up here.
You talked about how long it lasts on surface. Do we know how long it lasts on latex?
that was my question.
Great question, you
Oh,
all.
sorry.
So
No, I was thinking.
I saw it in the thing.
No, I thinking about it.
yeah, so that's an excellent question. I don't know if there's anyone who's done a study on. Why would anyone have done a study on coronavirus living on balloons, right? Like that's what
Right.
we're getting at. The closest thing we could probably look to is surgical gloves that are latex. Some early studies that were published in, I believe, the journal Nature had looked at other types of coronaviruses and the survival of other types of coronaviruses on surgical gloves. And the number that stuck out to me there was at a pretty high viral concentration. Around 70 degrees, it was less than 8 hours for survivability on latex. Whether or not you can extrapolate that from another human coronavirus to COVID, which is a coronavirus, I don't know, but I think it's a fairly safe first pass. I think some more recent studies on some other human coronaviruses have shown survivability somewhere in the 3 to 6 hour range if the conditions are dry. So if the virus is on a dry surface, it's not in some sort of droplet that someone's coughed onto a balloon. So to me, I'd say, well, what's the safe amount of time between when I can use my kit? When can I go twist, and when is my kit safe again? Early in the pandemic, my recommendation was if you're going to be out twisting and you can put at least 24 hours between your gigs and you put your bag somewhere where you're not touching it for 24 hours, hopefully in a not the frozen locked trunk of your car, but like a warmer environment that's dry. And as long as nobody coughed or sneezed directly into your bag, and I think that you probably would be safe around the 24-hour mark going back out to twist.
Well, and for a decorator, that's really what we do.
Perspective, I'm not saying that all the other factors might keep you more than 24 hours between gigs, but I don't know if I would say you need to quarantine your balloon kit for a week or something. That seems unreasonable. Also, I want to point out the titer from some of these studies. So the study I mentioned had a really high titer. So that means that the concentration of that virus was really dense. So there was a lot of virus in each particle used for this experiment when they looked at the 8-hour time. Whether or not that would actually represent what happens in the real world is another story. So are you likely to get experimental grade COVID titer droplets landing in your balloon kit? Probably not.
So I've got a couple things from our audience here. If you could very briefly explain what a viral load is. You mentioned that earlier, just for clarification. And then we have a question from Jackie Sacco. She says that she heard that copper doesn't allow germs to live on it for more than 3 hours. Sorry, it just bumped. Doesn't live on the copper for more than 3 hours. What have you heard?
I think I saw 4 hours for copper earlier in the pandemic. Excuse me. I don't really know, but let's come back to the viral load thing. And when I say viral load, I basically mean how much of the virus are you being exposed to? So the more virus you're exposed to, the higher your risk for becoming infected with coronavirus. Or if you have more virus in the droplet that was just coughed onto a surface, the chance that that will still be alive in X number of hours is higher. So the more there is of something, the more likely you're going to get sick from it, and potentially the more likely you are to get more sick from it. That's something else that we think we've seen.
In other words, if you catch it, let's say from somebody who is less sick, it's more likely that you'll also be less sick, in a very layman.
No.
Because they gave you less of a viral load?
No. Just because you're less sick doesn't necessarily mean you're shedding less virus.
Right.
You are exposed to more virus, the chance that you're going to get sick goes up, and you also have a slightly increased risk of becoming more sick because you were more exposed. But how much virus a person is shedding is in no way related to whether they are not symptomatic or they do have symptoms. The more sick someone is, the higher chance that they are shedding more virus, but it's not a one-to-one correlation.
Okay. And with so many people asymptomatic, how do we really protect ourselves? I mean, it's a very doomsday-ish kind of question, but.
Yeah, I think that the common mantra that we've been hearing throughout the pandemic, which is social distancing, hand washing, wearing a mask, not touching your eyes, your nose, your mouth until you've washed your hands or used hand sanitizer, is probably the best things that everyone could be doing right now. And asymptomatic spread is a thing. I've got a case here in Wisconsin. A kid went to a party, it was a party of a bunch of teenagers, and they didn't have any symptoms. The next day had a cough, tested positive, and half the party got COVID. And that kid was asymptomatic, so before they had symptoms. So you will be shedding, everyone is going to, if you have coronavirus, you were starting to shed the virus before you got sick. That's just a guarantee. You're going to shed most when you have symptoms, but you will still shed the virus before you get sick.
So that being said, Andrea, how many days do you think that you should wait before you go and get a COVID test? Let's say you start to develop a little cough. I know that this was huge. Like, I'm from the Midwest in Chicago. So this coming fall, a lot of people had allergies. And people, you had your itchy eyes, you had your runny nose, this little bit of a cough. And it's like, do you go right out and get a COVID test? Do you wait a couple of days to kind of see if, you know, your symptoms are heightening, and, you know, in the course of that, obviously you're quarantining? What's your recommendation?
Yeah, I think if you think that the test is going to change your behavior in some way, and you're experiencing symptoms like a cough, a fever, shortness of breath, get a test. They're pretty widespread now.
Right.
If you think it's just allergies and you want to wait a couple days and you're generally a young, healthy person, you got to put yourself in.
I just know people who have gotten like 6 COVID tests. So, you know, it's like anytime that they're like, oh my gosh, my nose is running, I'm getting a COVID test. I'm like, stop getting tested. You don't have COVID. Like, why don't you wait 24 hours, see if you develop a fever? You know, I think that people are like so panicked that they keep going and getting tested and tested and tested.
Yeah. I don't know if there's one necessary right answer to that.
If we could wrap this up with just one more question I've got from the audience here. Corinne Tom would like to know, does taking your temperature, sorry, it's grammatically incorrect here, let me think. Taking your temperature does not help tip off if you're infected? I guess she's asking you, taking your temperature, is that going to help tip you off if you're infected with coronavirus?
Generally, when someone mounts a fever response, which is your body fighting off an infection, usually that's not your only clue that you've got something going on. And usually a fever actually also makes you feel kind of lousy. It's not just the virus or the bacteria that's making you feel lousy. Your own body fighting the thing is going to make you feel lousy. So, I mean, you could monitor your temperature regularly, but I wouldn't make that your only screening method.
Okay, so I think we're going to wrap it up with that. We've got a couple things to cover, but first I really want to thank you, Andrea, for sharing all of this great information with us and taking the time out to come out tonight. And I'm sure the audience is really grateful too. We've got a lot of audience participation. Thanks for your questions, guys. Really appreciate it. We got a couple things to update you all on.
So I wanted to start, not really an update on Marissa Matthews, because we don't really have any news because the surgery was supposed to take place today. But we wanted to ask you all again, she's a member of our Float family, to have her in your thoughts and prayers. And if anybody either hasn't sent a card or wants to send another one, her address is 3760 Market Street Northeast, number 196, Salem, Oregon, 98301. We'll put it up in the Float group. It is in the Float group, actually. If you scroll down, her address is there. And I know, especially now that she's post-op, I'm sure she would appreciate, again, even just your thoughts and prayers.
And also, for anybody that doesn't know, tomorrow is our very own Steve Jones's birthday. Woo-hoo, it's your birthday. It's your birthday. So anytime during the day, if you want to send Steve multiple messages via Messenger, his email address, Facebook, and the Float, tag him in all of the fun happy birthday posts. I'm sure that he won't be mad at me for saying that.
Annual blow up your notifications day. So go for it, guys.
Yeah. All right, fellow Working Wonders, just as a reminder, this show is not just about us. We also want to hear from you as well. If you would like to email us in, and we will pick somebody to represent on the show every week, you can send in your own Working Wonder to floatworkingwonders@gmail.com. All one word, floatworkingwonders@gmail.
Wonders with an S, right?
Wonders with an S.
That's right. Yeah, just remember that Working Wonders is not just what we do, it's who we are. So I want to thank everybody for coming out tonight. Be sure to join us next week, where our topic is going to be branding. So we'll see you all then. Bye.
Bye. Thanks for coming.